Hello everyone, welcome to the next episode of Two Things. My name is Ryanne Thompson, I'm an internal medicine physician, and I'm here today with Cindy Yu, who is the Associate Medical Director of the Home Hospital Program, and Ryanne Coulson, who is a physician's assistant with Home Hospital. And we're here today to talk about the Home Hospital Program. Let's start first of all with a question for Cindy. So Home Hospital is a pretty straightforward name. Hospital care for patients at home, but what exactly is Home Hospital? What does the team do? Which patients does it serve?
So our Home Hospital program started about 2 years ago out of the capacity challenges that we've had in the hospital. It serves patients in their home. We see patients ranging from heart failure to COPD to pneumonia. In their home, we're able to provide antibiotics, a physician's assistant or a nurse practitioner along with a physician and a nurse go visit their patients in the home. We're able to offer some diagnostics at home along with lab work. We see patients who primarily are within care centers of Mass General, and most patients stay with us on service for about 3 to 5 days. And really appreciate having providers come into their home.
Great, thank you, Cindy. So a question for Ryan. So the sort of main provider on Home Hospital are our advanced practice providers. We have a couple of physician's assistants. You're one of them. We also have a couple of nurse practitioners. What is it like to visit patients in the home? And tell us about your provider role and sort of what you do for patients who are on service.
Yeah, so I think what we do in the home is very similar to what's done in the hospital as providers. We go in typically with a morning visit with a nurse and do all the diagnostics and all the assessment and treatment decision making for the day. And then the nurse goes in for a second visit later on in the afternoon. So they're getting 2 care visits a day in the morning with the provider and the nurse. I think what's been really interesting for me and the other APPs on the service and as part of the program is the difference between taking care of patients in the hospital and taking care of them at home. It's very, we set it up so it's as similar as possible so that they're getting the same level of care that they would get in the hospital at home. But often what's happening at home is not what we quite think is happening whenever we would historically discharge someone from the hospital or send them home from their clinic visit. We get a much more intimate look on what's going on at home, where someone's learning deficits are or knowledge deficits are in their care. And it really helps to bridge the gap between what we want to happen and what's actually happening for patients.
Great. I guess maybe one last question here. So if a physician or APP or nurse wants to refer a patient to Home Hospital, how would they do that, and how would we consider a patient to be on service? Maybe each of you can say a little bit about that.
So our referrals go through the Alternative Pathways Navigator. It can be found in the on-call paging directory. Typically, Ryan or one of our other APPs currently will respond to pages for referrals. I think anybody you're considering, please refer to us. We've had many patients, many providers reach out to us even when they have questions about whether the patient will be appropriate.
Right. And we love hearing or getting requests from primary care physicians or folks in the community or in the hospital that just think there might be something different that we can do for a patient. We can always point them, if it's not to Home Hospital, to maybe another program that the hospital has to really try to keep patients out of the hospital or try to serve patients wherever they are.
All right, well, thank you both very much. So please think about Home Hospital as a way to provide great care for patients in the comfort of their home who might otherwise need to be in the hospital. This is a great service that we're hoping to continue to develop and grow over time. Thanks.